It's a very important question, and I would really want all the listeners to please understand brain and body is not separate. They are talking to each other throughout the day, throughout our life. So, if I'm feeling threatened, my brain parts, the emotional center, the thinking part, which is in our frontal lobe, the pre-cortex area, it gets highly charged up, which results into my brain system feeling that there is a threat and I need to take a fight or flight mode. And this is inherited through the ages of millions of years of our evolution. So go back to the time when our pre ancestral time, that we came down from the trees and jungle life and started living in a cohesive social system. We all of us know through history that we were cave dwellers or tree dwellers. When the system changed, earlier from the jungle life, any unknown sound or unknown organism was a threat, and that part still remains in our brain. If we are constantly overcharged in monitoring कि something is not right or something needs to be, I can't handle it, the brain sends stress signals all over the body. There's something called in the hypothalamic, pituitary, and adrenal axis. It's a kind of a network from the brain to the body. And adrenal glands are the one of the epic centers which secrete stress hormones. So suppose again, I'll give the common example. Many of us, when we wrote the first high school exam, either we had a upset stomach, or we lost our sleep, or we had nausea feeling, or we were feeling dryness in the mouth, palpitation, any kind of things, because the fear of the unknown was overwhelming. And due to our social conditioning, most of the students till date are primed into that you have to do very well in the high school exam. But as we gave our second, third, fourth paper, these symptoms for most of the students disappear because the threat level goes down and the organism or the student feels, yeah, I can handle it. I know what's the structure of the paper, what is going to be the format, how I need to handle it. So going back to this basic example, if the student is continuously feeling all through the 10 exam papers the same scenario, the memory centers will be also overloaded by the stress hormone, which results into diminished memory registration. So we have seen now through a lot of research that people who are constantly under stress, they will have a sooner episode of memory related problems. They will have irritable bowel syndrome. They will have acid reflux or constipation and diarrhea cycle on and off. Immunity system goes down because again, biologically, we know through a lot of research that when we are hyper alert as an organism all the time, the metabolic system also changes into lot of immunity diminishing activities, something known as the bad chemicals overpower our immunity cells. So people who are under stress, one can easily identify they will have frequent cold and cough, skin breakouts, uh, frequent upper respiratory tract infections. Women will have irregular menstruation cycle if they are in the reproductive age range. I even see a lot of women who are trying to conceive, but if they are under stress, the natural conception doesn't happen comfortably. Again, it can in the long term result into coronary heart diseases. It can result into diabetic levels going very haywire because the stress hormones affects our pancreatic functions and the insulin regulation gets disturbed. So right from the emotional part of not being able to adapt and communicate effectively, which impairs the person's effective quality of life. Lot of physical ailments happen. People under stress do commonly report about migraines, tension headache, stress headaches. Even epileptic seizures are aggravated if people are under constantly stress. Lot of breathing issues. Small kids, I commonly see that there won't be any infection in the respiratory system, but they have wheezing, they have breathlessness. Many times people are admitted in ER with a almost similar symptom of a heart angina, heart attack, but actually it would be a severe panic attack. So the pulse rate would be haywire, kind of fainting scenario, very irregular blood pressure. Again, repeating, brain conducts all these symptoms because it is feeling threat. There is not a single disease which cannot be separated from stress. Uh, Even we have seen now that lot of type B personality people who internalize stress, they are more prone to cancers because again, the HPA axis results into inflammation going across the body, and excessive inflammation is again a apex center for cell damage and toxicity to happen. So to conclude, brain and body have to be comfortable, feeling relaxed. There will be moments of stress, but we need to learn to segregate it and not internalize it. Otherwise, the organs do get affected. I'll just use again from clinical experience because I work with a lot of transplant, organ transplant cases, and I see liver transplant patients. Some of them are um, chronic liver disease due to excessive alcohol abuse. And my first question is that why were you drinking so much? Number one reason is because I had stress. And then it results into the body part being damaged and whole quality of life going haywire. Because the transplant happens, we have an excellent team. The person's life is restored, but the quality of life is based on medication and lot of compliance to a different paradigm. So it is important that we don't reach those verges and we learn early on to deal with stress.